My name is Deborah Kioko, working with AMREF Health Africa under a project funded by Moderna Foundation called Thrive. And Project Thrive has been in Nyeri for 1 year now, and we have been conducting inreaches and outreaches within Nyeri County. And as we have been doing this, we noted that men have not been able to come for services as we opt as a project and as a partner to Nyeri County Health Management Team. So when we were doing our review for the project with the county team, we realized that we needed to focus to men so that they can be able to access services that they needed. Approximately 30% of men were able to access services that we have been providing previously, and that is a low number. When we are looking at the challenges that men are experiencing in Nyeri, especially when it comes to mental health, testing for issues to do with the urology, and even accessing services which are on issues to do with non-communicable diseases, that is hypertension, diabetes. Men have not been creating moments to come and be screened. We therefore decided to have this clinic in all the sub-counties where we are working in. That is in Mukuruine, Nyeri Central, Madera East, and Nyeri South. We are hoping to be in all those sub-counties so that we can access and provide services to all the men who are able to access the services that are being provided by the county health management team. Today, we are hoping that we are going to screen more than 500 men and be able to address some of the issues that they are having in terms of health, and therefore this is something that we hope we are going to continue doing, maybe on quarterly basis for the next 1 year. Really, every person should be able to access services on screening, because when we screen and we do it early, we are able to actually get those issues that are not you are not experiencing the signs and symptoms at that point, and they are treatable at that stage. So why, if we are able to provide the services of screening, why can't men come and be screened and be able to be provided the services they need on time? And it becomes even cheaper when you are screened and your issues are noticed early, and you are able to be given the services on time. From my observation, it's more of culture where you find men don't want to mingle with women and children, and therefore maybe those are the cases that or issues that prevent them from coming for screening. Looking at today, they have actually come out, they have left whatever they do to come and be screened. So, because they only know they are the people who are going to be seen, and we are ensuring they have the privacy that they have always needed. Mental health has come out to be another issue that we needed to actually put a lot of efforts in. And this has come from the dialogues we have had in the community, where community members have actually raised the issue that they need mental health services to be provided. I remember there is a time we talked about the suicides that are happening in Nyeri, and some of them, it's because people are not able to talk. They are not able to raise their issues, and they don't know where to go. So even today we have brought the counselors, the psychologists, so that men can actually air their views, or they can actually talk to the psychologist and be able to actually have one-on-one mental health care at this particular outreach or inreach that we are having today.
Kwa majina yangu ni George Madhenge. Mimi ni mkaaji wa hapa Nyeri na tumejitokeza kama wazee. Hii huduma mmeleta ni sawa kwa wazee kwa sababu unajua wakati huu wazee hawasikiki sana na wataki kujitolea ili watoke wapimwe. Sasa nimeona wamejitokeza na ni vizuri kwa sababu department zote ziko sawa. Kuna za meno, nini, macho na hata pressure, BP, hizo zote ziko. Na tumefurahia juu sasa hiyo ni ya bure. Unajua sasa hii hata kashi hakuna pesa. Sasa wazee wa kutoka huko vijijini wakisikia ni ya bure wanajitokeza. Sasa mmefanya vizuri kwa sababu hata vitu vyote sasa hata kama ni dawa nimesikia ni bure kupimwa na mtu ajijue. Na sasa tumefurahia na karibuni sana.
So good morning all. My name is Grace Mwangi. I am the sub-county MOH Nyeri Central, and we are here at Town Health Center. We are having a male-only inlet. This is an activity that was planned by the multidisciplinary team. Multidisciplinary team is a team that is involved in planning for health activities in the sub-county. And this is through Project Thrive, that is AMREF Foundation, AMREF Africa Foundation, that has really partnered with Nyeri County in offering services and more so to the community. In this male-only inlet, we have targeted to offer male several services, health services, and actually the purpose or the main reason as to why we decided to have the male only is because in the sub-county we have conducted several inreaches in several facilities, and we have also realized that health-seeking behavior is kind of low, because out of probably attendance of 500, only around 30% are male. So we probably thought that maybe male do not want to mix with the female, or maybe they would enjoy and embrace the male only inreach. And that is how we came up with one at Town Health Center, where it is more central in our sub-county. Actually, as you can see, we have received a good number of the male. The male have come, and I think that one is an eye-opener, that male want to be seen or consulted alone. So the services that we are giving them today include the general health education. We realize that nikiambiwa mimi najua, there are some members of the community who do not know how they are supposed even to eat the nutritional, the diet that they're supposed to consume, and so many other health issues. So we have included health education at the waiting bay, and also the individualized health counseling depending on the need of the individual male. We are also doing general consultation where we have our clinicians, we have our clinical officers, we have our family physicians who are actually doing the consultation to our male. We also have HIV counseling. HIV counseling is also incorporated in this inlet, where we are counseling the male. You know, we said earlier that the male health-seeking behavior of our male is a bit low. So that even means probably even HIV counseling, they do not go for that service. So we have incorporated HIV counseling in our inreach today. We are also checking on their PSA. We want to know, we have incorporated the urology services, and we have our urologist here, where we are testing for the PSA and also consulting them as far as maybe prostate cancer and other urinary tract infections are concerned. And this is something that to us, we feel that it really go a long way to help our male in getting to know their health issues in terms of urology system. So we are also screening for TB. Remember, TB is also one of the communicable diseases, and if even these male are not seeking health services, they could also be having TB back at home or at the community without having been noted. So we are screening them for TB, and also men have issues zenye wanakaa tu hawasemi. And that is why you find that most of the mental health cases that we have within our sub-county are actually the male gender. So we have incorporated the mental health services that includes the health education on mental health issues and also the individual mental health counseling. So we have our psychologists and mental health nurses and clinicians who are offering that service. So generally, that is what we are offering. And for those male clients that will be seen with conditions, both non-communicable conditions and other conditions, will also be offered the drugs that we have. So generally, that is what we are doing today, and we are really thankful to our main donor, the AMREF. AMREF is the one actually that has supported this right from the planning, everything, and also having this InReach realized, even the other InReaches, they are actually the ones that support, much to supporting the at least organization, even payment of some token to the staff who are working in the InReaches, and generally even the general planning of the activities. So we also have Equity Afya with us. Equity Afya is also partnering with County Nyeri Central Sub-County Health Department in offering this service. And we have also Neema Opticians, who are also offering optical services together with our health workers who are ophthalmologists and opticians. So I think that is what we are doing today, and we are grateful and we are happy that I think with the male only InReach, the male are coming to seek for the health services, and we hope and trust that by the end of the day they will have gotten what we had planned for them.
Moses wa Mugumo, nakaa Kingongo hapa Nyeri Central, Rware Ward. Nimekuja hapa sasa ndio tuweze kuangaliwa mambo ya prostate, sababu sisi wazee huwa tunakaa nyumbani, hatukumbuki kuangaliwa. Na ukiona mzee akienda hospitali lazima kuwa amesukumwa ama ugonjwa umefika mwisho. Nafurahi sana kwa hii program sababu wametarget wazee kama sisi barika yetu, na this program itasaidia watu wengi sana kwa vile itatolewa ile stigma ya kutokuja hospitali. Sasa mimi naomba wazee ambao hawajafika hapa tafadhali wakuje waweze kuangaliwa, wasikasubiri mpaka wakati utakuwa umewezeka. Kwa hivyo Nyeri County Government naishukuru sana kwa kutufikiria sisi kama wazee kuja kuangaliwa maslahi yetu ya mwili. Mambo ya blood pressure, mambo ya prostate, mambo ya yote ambao wanaangalia. Hata screening itakuwa inasaidia wazee sana Nyeri County. Shukrani kwa Nyeri County. Na kupima blood pressure ikakuwa niko sawa sawa. Nimetembelea ya sukari ikakuwa sawa sawa, na pia counseling. Sasa ile ambayo ilifanya sana nikuja hapa hivi ni mambo ya prostate. Sababu huwezi ukajua hali yako kama hujaangaliwa. Mtu anafaa kuangalia mara moja kwa mwaka. So my climax for today ni mambo ya prostate.